Good afternoon. It's already 2 o'clock. We start. So welcome all. I'd like to remind everybody to mute themselves, but always show your video picture so that I know who are my attendees. Okay. Please sign in your name, Facebook account, or email address in the chat box. Include names of the companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. So there'll be group pictures at the start and end of the pep talk. So please show your face in the video. As a reminder, please take the online learning CUM evaluation test exercise or OLETE for mastery of learning and try to get the perfect score to get the certificate. So I have placed the link in the chat box. The certificate looks like this. Let me report to you that as of today at 1 o'clock, okay, there were 33 complete OLETE passers. Okay, so thank you and congratulations for those 33 who have completed the OLETE as of this time. Okay, so this is a great accomplishment compared to the number was 28 in August 14 and 22 in August 7. So I hope more will catch up. Okay. So let's now have a group picture taking before we start in 2 minutes. Please turn on your video, show your face. Just put gallery view. Okay. Okay, there are 2 pages. Let's start. Page 1. Okay, 1, 2, 3. Let me just save this first. Page 2. Okay. Show your face. Ready? 1, 2, 3. Okay. Okay, let's start. The title of my pep talk today will be Basic Rights in Patient Empowerment. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this pep talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. The third module was on patient management process. We're now on the fourth module, which is entitled Patient Rights in Patient Empowerment. What I have in mind in my pep talks, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. There are 2 parts in the fourth module, basic rights, which we'll tackle today, and then the other one is patient autonomy and advanced directive. So for today, we will be talking on the patient rights in patient empowerment. The objective will be for the lay people to have an understanding of the basic rights in patient empowerment. The World Health Organization defines patient empowerment as the process through which people gain greater control over decisions and actions affecting their health. The WHO has identified 4 components as being fundamental to the process of patient empowerment. One of which is, the first one is understanding the role. Okay? So in the WHO definition, the rights in patient empowerment can be subsumed at the very least under this particular phrase, understanding the role. In a community of inquiry or survey that I conducted in June 2021, this year, among 55 Filipino respondents, we agree that patient empowerment can be translated in Filipino as pagpapalakas ng pasyente with the following 4 strategies or K4: kaalaman, knowledge, and understanding; kakayanan or capability; karapatan, rights; and kapangyarihan or self-determination. So karapatan means rights in patient empowerment. Before I go to the rights in patient empowerment, let me remind everybody that everyone has the right to health, which is part of the human rights. The right to health means that the nations, the states, or the countries have the legal obligation to promote the health of their citizens. The right to health has 2 components: freedom and entitlement. Freedom includes the right to control one's health and body, including sexual and reproductive freedom, and freedom from interference such as non-consensual medical treatment and experimentation. Whereas entitlement includes access to adequate healthcare facilities and services. This will be provided by the country or the nation. So rights in patient empowerment emanate from this human right on health, specifically on the freedom or the right to gain greater control over decisions and actions affecting the health of the lay people or patients. Every person has the right to make his own choices with regards to his health and health care. In the medical world, one of the principal ethical principles that has been established and being observed and being practiced by all physicians is patient autonomy. And patient autonomy means the right of the competent adults to make informed decisions about their own medical care. This principle underlies the requirement to seek the consent or informed agreement of the patient before any investigation, like laboratory examination or treatment, will take place. So the foremost right in patient empowerment is for everybody, physicians and healthcare providers, and even relatives included, to respect patient autonomy. Again, to repeat, patient autonomy is the right of all competent adults to make informed decisions about their own medical care. There are 2 keywords or phrases in the definition: competent adults and informed decisions. Competent adults means conscious, coherent, and discerning adults. Informed decisions means a permission or no permission is granted by the competent adults after this will occur only after proper understanding of the purpose of the procedure, options, different options for the procedure, with benefit, risk, cost, availability, data analysis, and consequences of the procedures to be undertaken. These 2 components or requirements must be fulfilled, meaning competent adults and informed decisions, for patient autonomy to be ethically and legally binding. Patient autonomy should be observed when the patient is being managed by a physician in whatever setting, such as when consulting at the clinic, at the outpatient departments, or inside the hospital as a confined patients. And patient autonomy should also be respected when being managed by relatives or significant others. When being managed by a physician, patient autonomy should be respected before any paraclinical laboratory diagnostic procedure and or treatment procedure take place. After the patient is properly advised, respecting patient autonomy can end up in either informed refusal or informed consent. With informed refusal, no paraclinical laboratory diagnostic procedure and or treatment are executed. With informed consent, the agreed paraclinical diagnostic procedure and or treatment procedure can be executed. To repeat, before the informed refusal and informed consent are decided upon, the patient must be properly appraised of, must have a proper understanding of the procedures that will be done, the options with benefit, risk, cost, availability, data analysis, and consequences of the procedures like complications, side effects that have to be undertaken. In medical practice, exercising patient autonomy is prominently seen in situations where terminally ill patients have to decide whether to have life-sustaining treatment or not. So whatever their decisions, the physicians will have to abide, thereby respecting patient autonomy. When being managed by relatives or significant others, especially during terminally ill stage, the wish and the decision of the competent adult patient should be respected as part of the right to autonomy. Aside from patient autonomy, the other rights in patient empowerment will include entitlements from physicians managing them and from the hospitals and clinics serving them. The lay people or patients should know these entitlements so that they can demand, as part of their strategies to gain greater control on decisions and actions affecting their health, particularly in terms of being recipients of quality and safe services. In my presentation of the other rights of patient empowerment, I will categorize them into entitlements from physicians and patients' entitlements from hospital and clinics. Let me say, though, that there will be overlaps with some similarity in both categories. And note also, I don't guarantee that I'll be able to list all of them at this point in time. So let's start with the patient entitlement from physicians. Patients are entitled to choose a physician they want to manage them, and corollary to this, change a physician anytime without having to justify their decisions. Patients are also entitled to have a second opinion from another physician and from other physicians with no limit and without having to justify their decisions. Patients are entitled to have quality services, which consists of the following: patient-centered and compassionate care, equitable care with dignity and no discrimination, effective, efficient, and timely services, holistic, well-integrated, and well-coordinated services, etc. They're also entitled to have safe medical care with no undue harms being inflicted on them. They have the right to information related to their health concerns, meaning they're being appraised on the diagnosis, paraclinical diagnostic procedures and results, treatment, prognosis, etc. They're entitled to have participation in the care decisions with their physicians. They're entitled to have informed consent and informed refusal without prejudice to continuing health care. They're entitled to have medical records of their medical consultation, such as physician notes and tape recordings of the interactions that went on. They're entitled to keep their medical records from other physicians and other hospitals and clinics and for physicians not to get and keep them without giving back or giving a copy to the patients. They're entitled to have no undue long waiting time for medical consultation. As much as possible, there is an appointment time for the consultation, and if physicians are not able to comply, they should at least forewarn or advise the patients. They're entitled to have privacy and confidentiality of medical consultation. They're entitled to know the professional bill or fee or the policy of charging prior to medical consultation. They can complain about the care and services provided without fear of reprisal. So those are just some of the patient entitlement from physicians. Now let's go to the patient's entitlement from hospitals and clinics. All of you probably, or some of you probably are aware when you go to the hospitals, there are posters entitled Patients' Rights and Responsibilities. Okay. This is required by the Department of Health. Okay. So no posters on patients' rights and responsibilities are the same. Okay. So they vary from hospitals to hospitals. So below are just some of my listing on the patients' rights and responsibilities in hospitals and clinics. All patients in hospitals and clinics are entitled to choose a hospital or clinic they want to serve them, and corollary to this, change anytime without having to justify their decisions. Have a quality and safe care in accordance with the generally approved medical and hospital principles. The hospital should have a patient safety program in terms of patient care, okay? And then the safe hospital initiatives in terms of a safe hospital infrastructure. All patients in the hospitals and clinics are entitled to have respect and dignity without discrimination, have participation in care decisions with their physicians and other healthcare professionals, have informed consent and informed refusal without prejudice to continuing healthcare, have a second opinion from alternate healthcare professionals of choice. They're entitled to be asked for consent for additional procedures to be done on them not included in the initial discussion or the initial prescription of their attending physicians. They're also entitled to be asked for consent or refusal to allow additional physicians to manage them beside their attending physicians. Have privacy and confidentiality of personal information subject to applicable laws, have right to information related to their health concerns and services being done to them, have the right to medical records in the hospital and clinics, avail of benefits and privileges in accordance with government regulations, be billed, be charged or billed accurately. So the patients have to monitor the medications and procedures done so that they can review their bill. Complain about the care and services provided without fear of reprisal. Patients in the hospital and clinics are also entitled to be discharged from hospitals or institutions upon the request and after settlement of accounts, and be treated at the Department of Emergency Medicine, or what is more commonly known as emergency room, without initial deposit, because this is a law. There should be no initial deposit before treatment in the emergency room. They can refuse participation in medical researches. So above, I presented the list of patients in power entitlements from physicians and patients entitlement from hospitals and clinics. As I said, there could be more that I may have missed. I will update this once I recognize the missing ones. I use the word entitlement to mean patients having a legal or ethical right to have or obtain something from the physicians, hospitals, and clinics. At the same time, they have the right to expect physicians, hospitals, and clinics to act in a certain way that will promote and facilitate quality and safe services to them. Knowing this entitlement will enable the patients to look for them, not to say demand, which redound to patient empowerment, which is gaining greater control on decisions and actions affecting their health. However, let me say that patients should be proactive, aside from the expectations of these entitlements and rights, which may not flow naturally or smoothly to them. They carry a responsibility to make them happen. They should ask, and if needed, they should demand if they are not being given the entitlements. They have recourses if the rights and entitlements are not afforded them, and worse, if they are in violations. Here are some recourses that patients can do. Remind the physicians, the hospital administrators, clinic administrators that they have to of your entitlement. Change physicians, hospitals, and clinics as indicated. Give feedback and hope for improvement of services. And file a complaint and hope for improvement of the services after filing the complaint. Complaints can be filed with the hospital and clinic administration and or with external monitoring agencies like the Professional Regulation Commission and or with the courts of law. The best promoting and facilitating measure in seeking and getting the rights in patient empowerment to enable patients to gain greater control over decisions and actions affecting their health is to look around now, as early as now, for the right physician, right hospital, and the right clinic. Once found, place them in the list of hotline numbers in the house or in personal files. In case a physician, hospital, or clinics is tested to be undesirable, change right away. Remember, the first right after patient autonomy is that everybody can choose his physician, hospital, clinic, anytime without having to justify. So there you are, rights in patients empowerment. Maximize your knowledge, kaalaman on these rights. Maximize your capability, kakayanan in seeking for and implementing these rights. Lastly, maximize your self-determination or kapangyarihan in using the rights in gaining greater control over decisions and actions affecting your health. With this, I end my pep talk for today, basic rights in patient empowerment. I hope I have empowered you to have better understanding of the basic rights in patients empowerment. So before we go to the QA and interactions, just a reminder, please take the online learning Kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate like that shown on the slides. I have placed the link in the chat box and also in the Facebook page and also in the Facebook group. Okay, so just again, just to show this slide for those who have not seen this earlier, as of August 21, we now have 33 complete elective passers. Okay, so it seems that I'm on target. As I said, the minimum will be 30. Okay. And then for those who have not attended last week's session, let me just repeat this. Okay. I have transformed the pep talk into courses. Okay. 3 categories of courses. One is the core course, health disorder courses, and then health issue courses. Okay. So the core course consists of the one that we had before, patient empowerment program, patient management program, a process, rights in patients empowerment, and staying healthy and contented. So we're done with the other courses except we're done today with the rights in patients empowerment, basic rights. And then next week, we will have patient autonomy and advanced directive. And then the last course for the core course will be staying healthy and contented. Okay, there will be 5 sessions: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and early treatment, and first aid and basic medical care. So the timeline that I foresee is that by October 2, we will be done with the first aid and basic medical care. Okay. So for those who will be completing all the OLETE in the patient in the core course will receive this certificate of proficiency in patient empowerment. And then as to the other 2 courses, health disorder courses, examples of these courses are COVID-19, we already done with that, okay. Cancer course, breast disorder, thyroid disorder, skin and soft tissue disorders, and others that will be developed in the future. Then we have the health issue courses. Example of courses will be the end of life management, palliative care, use of vitamins and supplements, patient-centered care, unnecessary operations, unnecessary medications. So for those who will be finishing the core course plus 2 courses on the health disorder courses and 2 courses on the health issue courses is entitled the Certificate of Mastery in Patient Empowerment. Okay. Okay. So with that announcement, let's now have a group picture taking before we go to the question and answer and interaction. Please show your video, turn on your video and show your face. Okay, we'll start with page 1, 1, 1, 2, 3. Okay, let me just save it for a while. Page 2, 1, 2, 3. Okay. Try to take pictures also at your end so that you have a souvenir. Okay. So the floor is now open to questions, comments, and other suggestions, interactions. Okay.